In the evolving landscape of personalized medicine, one of the most promising frontiers is not found in a DNA test or brain scan, but in a vial of blood. Scientists are now turning to metabolites, the small molecules produced during metabolic processes, as powerful predictors of future health. These chemical traces, which include amino acids, lipids, sugars, and signaling molecules, are like molecular fingerprints left behind by your lifestyle, diet, stress, and cellular function. And they are proving to be remarkably accurate early indicators of chronic conditions that often develop silently over years or even decades. Unlike genetic markers, which offer static information about risk, metabolic biomarkers reflect the real-time state of the body. They capture both inherited predispositions and how they are being influenced or moderated by external factors such as diet, physical activity, stress, and microbiome composition. That makes them especially valuable for predicting lifestyle-driven diseases like type 2 diabetes, cardiovascular disease, dementia, and even certain cancers. The changes in metabolite levels often appear long before clinical symptoms, offering a precious window for early intervention. Take diabetes, for example. Researchers have identified certain branched-chain amino acids, BCAAs, such as leucine and isoleucine, that tend to accumulate in the blood of individuals who are insulin-resistant, even years before their blood glucose crosses the diagnostic threshold for diabetes. Elevated levels of specific acylcarnitines and inflammatory lipids also correlate with poor mitochondrial function and early beta cell dysfunction in the pancreas. These metabolic disturbances form a fingerprint of pre-disease physiology, enabling doctors and researchers to spot metabolic drift before full-blown disease sets in. With this knowledge, dietary or behavioral changes could be implemented early, potentially reversing the trend. Cardiovascular disease, too, leaves a metabolic trail. Lipidomics, the study of fat-related metabolites, has uncovered lipid profiles that predict risk of atherosclerosis, even in people with normal cholesterol levels. For example, certain ceramides, a type of lipid involved in cellular stress signaling, have emerged as strong predictors of cardiovascular events, surpassing traditional markers like LDL cholesterol. These molecules reflect subtle imbalances in fat metabolism and inflammatory pathways that contribute to arterial damage over time. Tracking these lipid markers could help personalize treatment strategies for those at hidden risk, guiding decisions about diet, exercise, and medication long before a heart attack occurs. Dementia, once considered primarily a problem of brain pathology, is also increasingly being viewed through the lens of metabolism. Recent studies have shown that changes in blood metabolites, such as decreased levels of certain phospholipids or alterations in polyunsaturated fatty acids, may predict cognitive decline years before memory problems begin. Metabolomic signatures related to glucose handling, mitochondrial efficiency, and oxidative stress appear to influence both the rate of aging and the resilience of brain tissue. In this way, a metabolic profile becomes a kind of early warning system for brain aging, helping to identify individuals who could benefit most from early dietary or cognitive interventions. What makes metabolomics especially powerful is its sensitivity to lifestyle interventions. If someone with an elevated metabolic risk profile adopts a Mediterranean diet, begins a modest exercise regimen, and improves sleep quality, their metabolite levels often shift within days to weeks. This dynamic responsiveness allows researchers to not only identify risk, but also track the real-time effectiveness of preventive strategies. In studies comparing Western and Mediterranean-style diets, for instance, researchers have documented favorable shifts in lipid and glucose-related metabolites within just 1 week, offering immediate feedback on how lifestyle choices reshape our biochemical terrain. Multiomics approaches now integrate metabolomic data with genomics, proteomics, and epigenomics, allowing for a more holistic understanding of individual aging trajectories. In studies like the CIO project in southern Italy, researchers are creating longitudinal metabolic maps of healthy centenarians, individuals who have naturally avoided or delayed disease into their 90s and 100s. Their blood shows distinctive patterns: lower levels of pro-inflammatory metabolites, stable glucose-regulating compounds, and lipid profiles that suggest efficient fat metabolism and minimal oxidative damage. These signatures are increasingly seen as blueprints for biological resilience and extended health span. It's worth noting that the technology to decode these metabolic patterns is becoming more accessible. High-resolution mass spectrometry and machine learning algorithms now allow scientists to sift through thousands of metabolites in a single drop of blood. These tools are not just for elite research labs. They're slowly finding their way into clinical practice, offering a glimpse of a future in which metabolic monitoring could be as routine as a cholesterol test. Imagine annual checkups that come with a metabolic fingerprint, an early snapshot of your health future, complete with actionable guidance. Ultimately, metabolomics doesn't just tell us what might go wrong, it also tells us what is going right. It can reveal when the body is adapting well, when inflammation is low, when energy pathways are efficient, and when aging is occurring at a slower than expected pace. In that way, metabolic biomarkers are not just predictors of disease, they are indicators of vitality, pointing the way toward a life not only lived longer, but lived in better health.